everyone. Michael Gillis. I want to thank you for the chance to be here tonight. It really is a privilege to have this chance to talk to you a little bit about the dental side of acromegaly. I'll give you a bit of background about me. I'm a general dentist. I've been in practice now for almost 20 years. A graduate of Dalhousie. Prior to that, I spent some time at Acadia, where I studied biology for 4 years. After graduation, I practiced in British Columbia for about 6 years, and then after the birth of my first child in, I guess, 1998, we moved back to Halifax, and I've been here ever since. With acromegaly, I believe that there are direct implications of acromegaly on oral health. Those are features of the condition itself that affect your oral health. And also there are some indirect implications of the condition. And what I mean by that is, some of the medications that are used in acromegaly, they themselves have implications on oral health. Some of the conditions that occur along with acromegaly, diabetes, heart disease, there are dental implications of, there's a picture, dental implications of those conditions as well. So I want to talk a little bit about those issues too, and then the dental management of all those things together. So with the direct implications of acromegaly, one of the things that's striking about acromegaly is the jaw growth that takes place. And with the jaw growth, there can be implications for the TMJ, the jaw joint, and we all hear about people who have TMJ. That can be a concern. Also with the jaw growth comes movement of teeth. So as teeth move, there can be tremendous implications for tooth decay, for gum disease, for the way teeth are loaded, for the way teeth on the upper jaw interact with teeth in the lower jaw. And as they're kind of loaded, if teeth are moving, then the way they interact with each other can change, and fillings can get overloaded, teeth can break. Dental treatment sometimes may not work out. Another oral health implication of acromegaly is large tongue. With the large tongue, there can be implications for snoring and sleep apnea with that. Although I'm not sure, I never saw it in the literature, with sleep apnea and snoring, one of the things that is sometimes lessens the severity of that is a forward posture of the jaw, and that also occurs in acromegaly. So they may compensate for each other, I don't know. But certainly large tongue can be contributory to splaying of the teeth or moving of teeth as well. Another thing here that kind of has a bit of an effect as well is carpal tunnel syndrome in the wrist. People who have carpal tunnel syndrome as part of their acromegaly may find it difficult to brush and floss their teeth. So there are ways to manage those challenges too. And arthritis as well means things that may make it difficult to engage in regular oral health. One of the features with the jaw growth is the development of spaces between the teeth. Now this little X-ray there on the left side, that's a person who doesn't have acromegaly, just showing spaces between upper teeth. I believe with acromegaly, most of the spacing happens in the lower jaw. Is that a fair statement? How many here have spaces that they've found have developed between? Yeah, you certainly do. Yeah. And with spaces between teeth, it's a great spot for plaque to build up, for food to be impacted. And when that happens, then the whole kind of cascade of tooth decay and gum disease can occur. And ultimately that can lead to loss of teeth. So if we know that acromegaly is one of or the cause of that, then we can really watch for any movement of teeth and try to address those issues before they become a real problem. This one on the right, on your right side, that just shows a little bit of inflammation. That is a person with acromegaly on the right side. Tooth decay. Now, every day I get people who, I tell them they've got a cavity and they say, I don't feel that. And tooth decay very often, especially earlier on, has no symptoms. But tooth decay is certainly one of the things that happens with spacing in between teeth. We get it both on the biting surfaces of teeth and in between teeth. as tooth decay advances, that's when you start to get symptoms. Sometimes when you get symptoms with a cavity, it's almost not too late, but it's typically much more involved. With tooth decay, symptoms would include sweet sensitivity. That's probably the biggest symptom that we see when it gets to that point, and then cold and heat sensitivity. So with tooth decay, we get a cavity, you put a filling in there. With very, very large cavities, we may have to resort to the next thing, which is a crown or a cover on the tooth. And teeth with really, really big holes sometimes need to be extracted. In acromegaly, it's really important that we take tremendous, tremendous care in getting the bite right. So any of you who go to the dentist to get a filling, if you may get a filling done or a restoration done, you may find that, over time the bite may not feel right on that. And it's because perhaps the teeth are moving a little bit, or the jaw is growing, and the relative position of those teeth is changing over time. And that's something that you should discuss with your dentist. And dentists should always, every time they see a patient with acromegaly, just kind of take a look at the bite to make sure everything is still fitting together correctly, because the implications of missing that would be that teeth get overloaded and break, or the fillings or restorations would fail. With the gum disease in acromegaly, typically it's due to the food or plaque accumulating in spaces between teeth. And that causes the body to mount an inflammatory response. And then you get puffy gums that bleed easily. As it goes further on, and you tend to get bone loss as part of the inflammatory process. So your teeth start to get less supported, and then they start to get loose. And then people can lose teeth that way.